We also wanna talk about safety. The door that you came in is our one way in, one way out. Restrooms. If you came in through the mall near the restaurant, the restaurant has some restrooms, but then also in this hall immediately outside our door, if you go all the way down to the end, as if you can't go any further, and look to the left, you will see the restrooms there also. And I will also escort you if you need to be escorted. All right, so can I please have you put your names on the manila folders, and then any documents you have pre-printed, if you'll go ahead and put that inside of the manila folder. And then we'll make sure that everyone's ready for their instructor course. Thank you kindly. How exciting. For some of you all, we're renewing our instructor statuses. For others, it's what we already do. And now we're just going to go ahead and get the credentials to match all the codes that we currently run. What I did not have you do previously was to sign in on the roster. Whenever you're signing in, you want to verify that your name is spelled correctly and that your email address is correct, because your cards are all issued electronically. If everything's correct, if you'll sign under notes. And so Stephanie, this one's for you. And again, you're welcome. As soon as you're done, Allison, I will pass that back to Sarah.
I'm just gonna change my
Okay.
email address.
And so you can change it right beneath. Okay. And here we go. You're welcome. Do you want to change? Sorry.
Actually,
Okay. Thank you so much. Thank you. And you want this changed in for everything in our system, your instructor, cards, everything you want going to this address instead?
yes, please.
Okay, understood. We'll get it done. We'll get that changed in the system. All right, so we always start off with a quick review. And whenever you're gonna be teaching your courses to your students, we don't want to ever assume someone remembers something, because if you don't use it, you're going to lose it. And so what does CPR stand for? Okay, so that's the first question I ask, because they come into class and it's like, hey, I just have to go to work, and it's more than going to work with this card. We need you to know what class you're taking. So CPR, cardio, and then you want to ask another crazy question, such as, what organ are you speaking of when you talk about cardio? Hard. Pulmonary, students go blank. All right, so pulmonary, what organs are we trying to sustain? Lungs, okay. And so for our classes here, we only simulate rescue breaths, because we mostly train in-house healthcare providers. And so if there's an emergency in-house, it is rare that you're gonna be picking up a pocket mask with a 1-way valve. What would you be using to give breaths instead? The back mask device, okay? So we still have to teach it, because the videos show how to use those. And maybe one day we'll have mass immunity and no one will care that that 1-way valve isn't strong enough to prevent COVID from passing. But right now, that's not the barrier of choice. We need you to protect yourself. Are breaths even required?
No.
No, okay. Compressions are required, all right? So hands-only CPR should always be the focus of any time you're teaching CPR. You wanna make sure that they know how to do those compressions, which means that our order of priority has changed. In nursing school, it's always gonna be ABC, ABC, ABC. It's drilled in our brains until someone goes into cardiac arrest. When they're in cardiac arrest, it is no longer ABC. If you look at your papers there, what's the new priority at the very top? CAB, circulation. There's still residual oxygen in the bloodstream. It's just not moving until you start doing those chest compressions, high quality chest compressions. Give me a component of high quality chest compressions. Allison, how deeply do you compress for an adult?
2 to 2.4.
Perfect. Stephanie, how fast do we compress for all ages per minute?
100 to 120.
Okay, great job. I'm trying to remember names as I'm doing this. Sarah, the AED is extremely important. What does the acronym AED stand for?
Automated external defibrillator.
What does the energy that the AED delivers, what does it do to the heart's rhythm?
Restarts it or changes it.
Yeah, so you all may want to take a little note of this, because you may see this again on the test, hint, hint. The AED normalizes an abnormal heart rhythm. So we need to get that to the scene as fast as possible and utilize it. What does ROSC stand for, Allison?
Return of spontaneous circulation.
So when you were teaching your classes and you're teaching somebody who's working at a restaurant yesterday and their goal is to be now a CNA who's gonna be working in the hospital, the video's gonna say terms such as ROSC. We wanna make sure that we're using terms that these students can understand. So we need to prepare them for the test, ROSC. In parentheses, the pulse returns. That is the goal of high quality CPR. So you wanna be using terms like that interchangeably so they can connect the dots. If they don't know what ROSC means, they're gonna be less likely to answer the question correctly on the test. But in the real world, no one is like, hey, he's achieved ROSC. Minimizing interruptions, Stephanie. How long can we take our hands off the chest? Max.
10 seconds.
10 seconds. And so this gets tricky because we've been focusing on airway for so long. So if a victim in sudden cardiac arrest vomits and you're by yourself, your team members haven't come yet, what do you focus on?
The compressions.
So if you want to turn them to the side and clear out their airway, that means that blood isn't circulating to what vital organs? The brain, the heart, the lungs. I want you to think of it like this. Pneumonia is a disease of the living. If we can keep your heart going, we can fix whatever issues we have with your lungs. Once we achieve ROSC, we can suction, intubate, give you antibiotics, but let's just keep that blood circulating and flowing. If you are giving compressions and providing breaths, what is the ratio for adults? How many compressions to breaths? 30 to 2. See, your teammate took one for you. No, you did right. All right, and so in a few moments, we'll get up and actually practice with the mannequins and the equipment so you can actually do some hands-on, but I'm doing this to prepare you for your test. Your first test this morning is the same test that you'll be issuing to students. It is the provider level test. And when the American Heart Association says provider, that's their way of saying student. Okay, so you have to make a score of 90% or better on the same test that the students get to take. What would be a passing score for a student taking that test? 84%, but you have to be smarter than your students, okay? All right, so I did not do introductions, so I do want to backtrack. My name is Eunice. Welcome to class. Welcome to Florida Training Academy. I've been a nurse now for 23 years. I've been teaching for 14 years. It's been really cool. Started off with CNAs and then from there progressed into CPR courses and then from there progressed into teaching and training instructors. And so I train instructors actually globally through multiple brands of CPR companies. So outside of the entrepreneurial factors, the main reason that I teach CPR is freaking safety. I want to keep patients safe. And so when you have nurses and doctors who are afraid to provide care, because it's not just nurses, it's also doctors, they see something crazy on the monitor and they run away instead of running to, we are going to be those people who help them to understand that they can actually respond and actually provide patient care during an emergency, and that it is okay to perform those chest compressions. Is it a possibility that we could crack ribs? Yes. Some students won't know that, and if you tell them that, they're going to be afraid to actually compress deep enough. This is what I want you to remind them of. If they don't compress deep enough, we won't get to the heart. And if we don't get to the heart, what happens to the blood flow to the brain? Doesn't get there. So for these few moments, we're going to sacrifice those ribs to make sure that we can save this person's brain. They will have the rest of their lives to heal from that rib cage injury. But if you don't compress deep enough, how do we reverse brain death? We can't. So when you're teaching your classes to enforce, to just, keep staying, hey, let's make sure we do these compressions deep enough. Our mannequins for American Heart Association have feedback devices. What 2 feedback devices are required? The visual, and so that monitors the what? Get 2 lights. The rate. How do you know if they're going deep enough?
Sound.
the sound, so usually it's gonna be a clicker, so you have a compression rate and a compression depth monitor within your mannequins, and that's a requirement for all adult mannequins for the American Heart Association. And as a reminder, most instructors don't have child mannequins, because for AHA purposes, you can use the adult mannequin for adult and child CPR. So when you're purchasing your supplies, you only need adults and infants. Safety is the reason why I teach CPR, the reason why I train other instructors, making sure that those patients stay safe, and making sure that if one of our nurses that came through Florida Training Academy, or one of our CNAs is on the team with you, that they actually know what they're doing and that they actually care about the actual training they provide. Allison, what's your reason for becoming a CPR instructor?
My reason is somewhat of the same, safety, because many times, individuals just don't feel comfortable, in providing, CPR. They'll run away. Something happens and they just lose it, or they just don't feel confident enough.
And right now, they're dependent on the nurses, and right now, the nurses are so young,
Yes.
until they're dependent on the nurses, and you have a whole bunch of young nurses depending on each other. And I don't want my grandmother being in the hospital without seasoned nurses, or nurses who've been trained by one of our instructors.
Yes, and I was really compelled, because my mom was in a hospital and it was a new nurse, and her response, and I'm like, it needs to be more teaching
Yes,
before, they come out, just to give that confidence, not that she didn't know what she was doing, just to give that confidence.
just to give that confidence. And we want to give them grace, so kudos to new nurses, we need you all, but as experienced nurses, we also know that sometimes we're not at the bedsides as often because we're going to leadership roles, and so if we can always provide a guidance to them, it will help them tremendously. Stephanie, what's your reason for being a CPR instructor?
I would say just to spread knowledge. Yeah.
Okay, awesomeness. Have you, give me like one of your most positive moments from teaching CPR?
I guess putting it into action.
Okay.
Yeah.
Because you get to see it full circle in your facility.
Right.
That's great. Welcome. All right, so what's the reason why you're becoming a CPR instructor?
I've always been interested in education, and I want to help teach some of, obviously nurses can use refreshers too, especially the new nurses, but we're gonna be teaching all of our staff, even our techs, our BHAs that might not have a medical background, so it's kind of their first introduction.
Yes.
So I'm excited about that.
And I'm always planting seeds, because that BHA, if they find a nurse they like, they're like, oh, nurses just don't work in the hospital? No, we're like everywhere. We're in administration, we own our own clinics, we own our own companies. So it's really, mind-boggling when they're like, when they see a nurse outside of the hospital setting for the first time.
Right.
All right, so we talked about CAD, we talked about ROSC. There is a term that I need you to write down. The term is agonal. 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 What is an agonal breath, Allison?
Agonal breathing, it's, shallow.
Okay. And so, will you feel a pulse?
It could be faint.
Okay, and so usually it's a precursor to death. There are no signs of life, the person lets out a gasp, and for somebody else, that's gonna confuse them, because they're like, oh, the patient's breathing, and it's gonna delay their care. But agonal breath, you're checking for a pulse, and you're checking for breathing simultaneously. You don't feel a pulse, but the person does, they let out this odd sound. You need to start CPR. It is a precursor of death. Knowing your role, Stephanie, we're in the OR today. And the resident to doctor who's just interning doesn't know our roles. We all have on the same color scrubs, we have on our surgical gear, full PPE, whatever the case may be, can't see our badges. And he tells you to intubate. It's not that you can't, but is there a better option?
Yeah, that's on their
scope.
I can bag.
You can bag, so knowing your role and limitations, whenever the team leader is telling you to do something and it's beyond your scope of practice or expertise, you need to speak up, okay? Years ago, they taught me how to intubate. Now, I could probably do it, but I'm going to pivot on the teeth. The person's going to lose the denture. I'm not going to do it correctly. There's respiratory therapists for that. There's an anesthesiologist for that. So, doctor, I can't do X, Y, Z, but this is what I can do. Closed loop communication, Sarah, do you know what that means?
Yes.
Okay.
I'm not sure if I'm gonna explain it correctly, but it's asking someone to do something and having them return, verbalize that they're gonna do it, and then know it's getting
Perfect
done.
answer.
Okay.
Perfect answer. So it's making sure that we're just closing that communication gap, and so if the team lead gives you an order, you repeat it back to them, kind of like when the doctor calls, give you on the phone, you verbalize or repeat it back, and then if they give you 2 orders, just be like, hey, doc, I haven't finished the first order yet, okay? Any questions as you review your sheet before we get up and start practicing our skills? Okay, let me cut on some air and I'll get your mannequins.
BLS class?
Check her receipt, because we don't have a BLS class today. All right, so everybody, if I can get you to stand up and come to the front. Alright, so what I did not do, in preparation for everyone here, was I did not test our equipment. So you, as a CPR instructor, would always be responsible for testing the equipment before your students ever arrive. So what do we need to be testing with this mannequin?
Making sure the feedback mechanisms are working.
Okay, and if I compress down here at the end of the breastbone on the xiphoid process, would my hands be placed properly? It should be above that. So you want to teach your students to avoid the end of the breastbone. I tell them to pretend the person has a perfect nipple line, okay? So I'm gonna press. You heard a click, and now you have a series of rainbow lights. Red means dead. 1, 2, 3. 1 green light means you're getting warm, but you're not there yet. The goal is to get 2 green lights, and you want to explain that to your students. 1, 2, 3, 4. When you compress at the appropriate rate and depth, you're going to get 2 green lights. When you get 3 lights, it's going to be 2 green lights and an orange light that's flashing at you really fast. That's reminding you to slow down because you're not allowing chest recoil. What is the purpose of allowing chest recoil?
Circulation fills.
Circulation, the heart can fill up with blood again. And so a lot of us will be like saying things like diastole or diastolic, and your students won't know that. So give the heart time to rest and relax so it refills with blood. All right, so we checked the batteries, they work. I recommend that you all purchase a whole bunch of rechargeable batteries. Otherwise, the batteries die really fast, all right? And if you're not gonna use your equipment for a little while, take the batteries out of the compartment that's beneath it. We only simulate breaths in class, so we have the students, when they do their head tilt chin lift, to say the word breath and breath. If they physically gave a breath, what will they see as a result? Rise and fall of the chest. If they don't see rise and fall, what should they do with the mannequin or the human?
Repositioning.
Exactly. What is this device called?
The bag mask.
The bag mask device. So this is the reason why in our classes we simulate breaths, because working in the hospital for years, I've never seen a nurse pick this up. Okay? We have to use this because the American Heart Association video shows this. But I don't know if you all feel comfortable breathing in the equipment, and if so, that's what you do, and that means that every one of your students will have to also do the same, even with rising COVID rates. So you decide what is best for you and your audience, but for me and my healthcare providers, I'm not gonna be willing to take that chance, okay? All right, so whenever someone's using a bag mask device, where are they in relation to the victim?
On the page.
So think about respiratory therapy. They're always at the head of the victim. When you're using the bag mask device, what is the technique, the hand placement called? EC clamp technique. And so I find that on my best day, I tend to use my leg. So when you're recommending your students or telling them how to do this, and I'm talking to a group of students at one time, I'll tell them to hold the bag with their dominant hand You're going to secure the mask with your non-dominant hand. And now, Stephanie, what should I do now?
With the jaw,
With these,
with the 3 fingers.
okay,
The E.
okay, the E, and now what do I do?
You're gonna put pressure down with the C.
Okay. And now what's next?
You're gonna squeeze that back.
What's wrong? Too fast and too much. What am I going to make the victim do if I give too much air, put too much air in that chest cavity?
Vomit.
Vomit, okay? And so, 1 and 2. Stephanie? If you'll stand over here. If you'll come and practice with the back mask device, right? Open up the airway, and I recommend also using your leg. Right, give a breath. Make a tight seal with your mask. I think I see a gap. It's near the eye.
I felt a gap.
Okay. Good job. And just half a squeeze for 1 second. Half squeeze. Are you seeing chest rise? No? Okay, tight. And just half squeeze. As soon as you see chest rise, you stop. Perfect. As soon as you see it, stop. Perfect. And now, would you please also have Allison repeat that, okay? What you just did, if she has any help, if she needs any help, Sarah, you'll be the one helping her. Keep it open. EC clamp technique. You see it right there, Stephanie?
There we go.
Yeah. Okay. Great job. So ladies, your scenario will be, and if you'll please pass the mask to Sarah, please, the back mask device. Mhm. And so this is gonna be your scenario, everybody. And Stephanie, because she's renewing her certification, she's gonna be monitoring you all. You're gonna be working in a hospital. You've been called to a room because someone is in distress by a CNA. You have to do your whole scene assessment, tap, tap, is everything okay? Check for 2 things simultaneously. What's your BLS assessment? Breathing.
Awesome. Chest rise.
Awesome, so you'll be checking for the carotid artery, checking the carotid pulse for no longer than 10 seconds. And then when she calls for help, that is when you will come in, okay? So if you'll step back, if you'll start to do your whole scene assessment, start with tapping and shouting.
Okay.
Are you okay? Are you okay? Help.
No pulse,
No breathing?
no
Okay.
breathing.
What device do you call for?
AED.
Okay, all right, and so she did call for help, you all can go in, all right? All right, hands on the chest, you're gonna start chest compressions. And you can put that mask on the face, don't delay. Don't delay your chest compressions either, let's go. Gotta count and press.
You're looking at that. 2 green lights. Good job.
I don't hear a click. You gotta press deep, I'm not hearing the click. Perfect. Count so we can hear you.
13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
All right, lift your hands, we call this hovering. You look, take them off the chest, and that way rescuer number 2 can see chest rise. Good, back to the chest, less than 10 seconds, let's go. 1, 2, keep, so if you stay ready, keep that airway open. Don't slow down. 13, count with her, because she's getting off beat.
17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Hover. 1, I didn't see chest rise at all, so you reposition. Now, the compressor doesn't stop compressing.
4, 5, 6,
Open up the airway, keep it open.
9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
2 breaths. I'm not seeing chest rise, reposition. Okay, let's try to help you out. Stephanie, would you help her?
Sure, do you want me to take over or do you want me to just?
I need her to get her 2 breaths in.
15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30.
Let's switch.
Okay, so I can see what it is. It's this side over here, but you go ahead and start compressing. You gotta count for us.
5, 6, 7, 8, 9, 10, 11, 12.
Hover. 1, 2, let's go again. Good job.
2, 3, 4.
Great job, team.
7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
That was cycle number 2. 1 and 2. Let's go. 2. You have 3 more cycles. Great job. 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Are you seeing chest rise?
We'll fix it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1 and 2, okay, last one. And then after this, would you take over Airway so Stephanie can do her compressions?
12, 13, 14.
Great job counting together, team.
18, 19, 20, 21, 22, 23,
Great job, get in place, get those 2 breaths. 1 and 2, okay, let's go.
2, 3, 4, 5.
Probably use your left leg, Allison. Make a tight seal, tight seat.
18, 19, 20, 22, 23, 24, 25, 26, 27, 28,
I'll
29.
put this 2 breaths. Okay. 1, okay.
1, 2, 3, 4,
5, 6.
7.
At this time, we'll give our 2 breaths, everybody. They're still practicing. Great job, Stephanie. 1 half squeeze and another half squeeze. Good job. Let's go. 1, 2, 3. Great job, ladies. Stephanie only has 2 more cycles left. Great job, Stephanie. 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 breaths. 1, 2. We have to intubate this mannequin. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Great job, you all. Go team. All right, so that's why they have respiratory therapists, because as you see, as nurses, we're struggling with this area right now. All right, and so we did call for the AED. And for classroom purposes, I don't bring the AED right away because I need to see everybody do their 2 minutes of CPR. So everyone here has circulated, we did 2 minutes of CPR. For our classes, we use the table, and we use the table as a simulated medical bed because in the hospitals, we're gonna have beds, and if someone, even if they did collapse on the floor and go into cardiac arrest, we usually raise them to an elevated surface. So if you're gonna be teaching a mixed group of people, maybe like your cafeteria workers, etc., you're gonna have some classes that are gonna be conducted on the floor and others that can be conducted on the table. Okay, so any questions about this base part? All right, so let's incorporate the AED. All right, so everybody, what is the first thing you do when the AED arrives to the scene?
Turn it on.
Turn it on. And so your students are going to be very eager to try to press the shock button. I will remind them that this is an AED training device and that no real shock will be given. All right, so I'm going to power it on and then I'm going to listen to the prompts. As you're listening to the prompts for our AED, I'm not going to turn it on just yet. It is going to say apply the pad. So you want to be showing your students the pad placement even before you start the AED, because having 2 voices speaking at the same time can be distracting. And so high right, low left. And when we say low left, a lot of students are going to put the AED on the stomach. Think of where the apex or the strongest part of the heart is. I'll tell them to raise the breast tissue and lift it up, and that's where that pad should be placed. Something else I'll do is actually have them with their own hands place their hands where the pad should be. So it'll be a hand here and a hand here. Can you use an AED on a pregnant mom? Yes, you can. Your students might not know that, or they're gonna think they're gonna injure the baby. And right now, if mom's heart is stopped, that is injuring the baby. We have to keep her alive, keep the blood circulating until we can get her to the hospital, and then if we need to deliver the baby, emergently, we can. Power it on and listen to the prompts. Do not assume you know how to work it.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Pads are in place. It's now telling me to
Apply pads. Plug in connector.
plug in a connector.
Analyzing heart
We
rhythm.
cannot touch when it's analyzing.
Do not touch the
Everyone
patient.
stand clear. It'll pick up our heart rhythm.
Shock
You
advised.
wanna do compressions while it's charging?
Charging.
4, 5, 6,
Stay clear of
7, 8,
patient.
9, and Stephanie will clear me before
Deliver
she fires.
shock now.
Everybody
Press
clear?
the orange button
Prepare to
now.
shock,
Shock delivered.
resume compressions.
Begin CPR.
4, 5, 6, 7, 8.
Stephanie, what is that tone called?
Metronome,
And what is the metronome for?
to keep pace with the rate.
And all AEDs that correspond with the American Heart Association guidelines should have a metronome. For classroom purposes only, I'm turning off the AED. Stephanie, will you repeat that? For classroom purposes only,
For classroom purposes only, I'm turning off the AED.
would you please turn it off? Because I've seen students watch exactly what I do. And if I turn off the AED, when they get through with their demonstration, they turn off their AED. And so you want to really emphasize that this is going to stay on until this person reaches their final destination, which if they're in a nursing home, it's going to be the ambulance, and the ambulance is going to be the hospital. We're going to keep that on until all those ACLS providers figure out what the cause of the cardiac arrest was. How often will an AED reanalyze?
2 minutes.
Every
5
2
cycles.
minutes, 5 cycles. And how often do you and your compressor, your partner, switch?
The same.
So every time this says reanalyzing, that's gonna be your cue to switch places again. And very good job on that switch. You were like, hey, let's do it. Very good job. Any questions on the use of the AED? It gets confusing, but there is a video. And so once we actually get you into the systems, you'll see the instructor network, the portal, and you'll see that they have videos on high quality BLS or the teamwork, because the American Heart Association has you using an AED as if it's a manual defibrillator. So if you're teaching heart saver students or laypersons, you want to use that AED exactly as it says. When it says stand clear, you stand clear for more than 10 seconds. But as a basic life support provider, when it says charging or shock needed, what do we do during those few seconds? Resume compression. So as a basic life support provider, we actually end up clearing the person twice. If you're not teaching that audience, use the AED exactly as it states, okay? Because we don't want to confuse anyone.
If you're not teaching if you are teaching BLS,
Mhm.
do,
Compressions.
do compressions, okay.
Yes. If you're teaching basic life support providers, you should be doing compressions when the machine is charging, and that increases their survival rates or their chances of actually achieving ROSC. Okay, what about you? Any questions? No. All right, let's put it together. All right, so I'm going to be the CNA who is compressing. Stephanie is going to be the instructor who's monitoring. Come on now, Stephanie. All right, which of you two ladies want to use the AED? All right, so come on over here. And I only listen to you. I don't listen to the AED. It's like I can't even hear it all of a sudden, okay?
Okay.
So if you want to sit it down, and you'll be working around me, okay?
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
25, 26, 27, 28, 29, 30.
Apply pads. Plug in connector. Analyzing heart rhythm. Do not touch the
Clear.
patient.
Okay, step back.
shock advised.
Continue CPR, very good.
Charging. Stay clear of
Got
patient.
it, clear, step back from patient,
Deliver shock now.
shock being
Prep
delivered,
shock delivered.
Continue CPR.
Begin CPR.
too fast, too fast.
Bad. All right, and now what do you say before you turn your AED off when you're teaching
I'm
your
turning
class?
this off for classroom purposes.
Perfect. Great job, team. Any questions on adult BLS, CPR, how to work as a team, and how to use the AED, or what that tone is for?
I have a question.
Mhm.
My AED, I think it's similar to yours, and it does say stay clear. So
Okay.
I'm just gonna be talking over that and saying resume compressions, okay.
Yes, and if you can explain to your staff that, when it is charging, we're not interfering with the analysis, and we're also not going to put anyone in jeopardy. So
Okay.
when it's charging, it's just pretty much transferring energy. So we can actually provide compressions during the period when it's charging, but before you actually press that shock button, everyone clears because that energy could transfer into me and then put me into an abnormal rhythm. I'll end up getting shocked too. What other questions do we have about adult BLS? Go ahead, dear. Okay.
And the tone is to help you keep with the.
Yes, and it's called a metronome. Okay. So, child CPR is very similar to adult CPR, with the differences being if a child goes into cardiac arrest, more than likely it was not due to ventricular fibrillation. What would be the cause? Respiratory. So if we can add that preventative measure, keeping small objects away, making sure the pools and stuff are locked up, and that we're actually keeping track of our kids and what they're doing, we can help prevent a lot of those cardiac arrests from occurring. Now, as far as the number of rescuers, if you're by yourself and it's a child or an infant, a child being 1 to puberty. So, question, I ask this of everyone, my son is 10 years old, he is 115 pounds, and every day he sizes me up, because he's about right here right now. Is he a child or an adult?
Adult.
He is an adult, okay? 115 pounds, almost as tall as I am, okay? So, keep that in mind, even if he has on a SpongeBob shirt. For a child or an infant, they do not have to be dead before you start CPR. Heart rate has to be less than 60 with signs of poor perfusion. What are signs of poor perfusion in someone who is brown or black?
Pallor,
Okay, and so if you're teaching someone who was working at Burger King yesterday, what does that mean?
Like gray lips.
Gray lips, okay, and something that's easier to also see,
Fingernails.
fingernails, okay, so sometimes they'll say cyanosis a whole bunch, but that really refers to Westerners or Caucasians. We usually don't turn blue, so when you're teaching your classes, make sure that you tell them what to expect in someone who's not Caucasian. Because if an African American or Hispanic goes into cardiac arrest, they are more likely to die just because of their environment and the people around them not even understanding what's happening, and no one really going into those communities and teaching CPR. So we want to increase the chance of survival for all communities. All right, so a child is from 1 to puberty. They don't have to be dead. Heart rate less than
60.
with signs of poor perfusion, so you'll be discussing that. And if we want to prevent a child's arrest, what do we need to do? What are some preventative measures?
pools, you
Pool
said?
gates.
Yes, yes, yes. If there are 2 or more rescuers with a child or infant, we change our ratio. What's the ratio?
15 to 2.
Why?
Increase the amount of respirations.
Air 5.
Oh, Air 5, sorry.
Great job. So it's the same number of compressions, but you end up giving double the breaths. So if you were by yourself trying to do 15 to 2, you would be exhausted because you're trying to breathe 20 breaths per minute and give a child 20 breaths per minute. So if you're by yourself, it is 30 to 2 with a child or an infant. But when your team member arrives, you switch to 15 to 2. All right, so let's just practice that really quickly. Would you get the back, Stephanie?
Why is it, I feel like I should know this answer, why do we not do that with adults again?
Because if we go into cardiac arrest, more than likely it was ventricular fibrillation and not due to our airway.
I got you.
Okay, all right, and so like the young folks say, and I say this every class, if you stay ready, you don't have to get ready. So, everybody, this is a 6-year-old. Remember, we can use the adult Manikin for child BLS. And so I'm gonna do 15 to 2. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, leak those
Leakage.
breaths, okay, let's give it. So, a little. Sorry, body. Can we try? Let's
Yes,
switch places,
yes.
okay? Let's switch places, you're over here, let's go.
Yes, oh, you got it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Okay. Okay, so I think I figured out the problem. Whenever you're giving breaths, you all are bringing the bag up. And
Oh, I
so
have
you're
trouble with
breaking the
my
seal.
arm.
And so I've been looking at everyone's hand placement, so if you can keep the bag down, it'll more likely stay sealed. Now, if this was a child or infant and we were having problems maintaining his airway, we're not gonna be bagging them with a bag mask device for long. We're gonna be thinking about intubation, some other type of device in order to sustain that airway. So do you all understand how to perform CPR if there are 2 rescuers on a child?
Yes.
Okay, let's go to our infant scenarios. Is this a good review for you?
Yeah. No video, just,
Yes, for our instructor courses, no video yet. It is coming. Because I like to start you off by taking your test. We'll take a quick break. And then after your test, then we can start with the rest of our program. All right, so this is little Joey. All right, so Stephanie, would you please show the other instructors how to power the baby on?
you can't power, oh,
Yes.
my babies don't power on.
Your babies don't power on?
No, they
And-
just,
And it's
they
not a
don't have
requirement.
the lights.
Yeah, for the infants, it's not a requirement, it isn't a requirement for the adults, okay, all right, and so, same exact feedback devices, same indicators if you purchase the infants, I just like the, how everything is like same flesh color or whatever, and so they do have diversity packs, so you'll have mannequins with different, skin tones, and that also gives your students more, realism, everything can't be all one ethnicity. All right, and so whenever you're compressing deep enough, pretend I was at the side, same exact thing, you'll get your 2 lights. You don't want to be compressing on the throat, don't compress on the end of the breastbone, nipple line, and press down. If your student cannot press deep enough with these 2 fingers, your index and your middle finger, don't force them to do that. They can use a different technique. Stephanie, would you show the alternative technique?
The 2 thumb circling technique.
Yes.
2, 3, 4.
So for this, if they can go deep enough, I'm not so concerned about, because I have students sometimes who don't have all their fingertips, maybe due to a traumatic injury. So I can't be like, oh, you must do it this way. No, what I need to see is you actually compressing deep enough to get those lights to compress. And if you have to do it with 2 thumbs, you do it with your 2 thumbs, okay? All right, so our babies, you thought the adults were difficult. This came from the manufacturer. Sometimes it's hard to give the breath to the baby. Okay, so I was able to get it this time, but I had to overextend the baby's neck. And we usually don't bring a baby's head that far back, okay? So if you see breaths with our mannequins, great. If you don't see breaths with our mannequins, especially our infant ones, because I know they're hard to ventilate from the manufacturer, we don't make them, we buy them, and then we figure out things don't work well. We're just gonna act like we did. Because in the real world, if we were having a difficult time bagging a baby, what would we do? We would intubate. We would just go ahead and tube them, and then we breathe through the tube. That way we can make sure they're getting the breaths they need. All right, so Stephanie and I are gonna back out. All right, you're gonna do 15 to 2 on this infant. All right, so go ahead and get into place. 15 to 2, and so anytime it's 15 to 2, if there are 2 or more, we do ask that you just divide the baby a little bit more, and you'll do the 2 thumb and circling hand technique. All right, and so trying to bring the baby's head back so far. All right, and then I'm gonna have this bag over here. All right, so let's go, everybody. Here we go.
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Nice and slow next time on your breast.
2,
And half squeeze. 5, 6, 7, 8, tight
9,
seal.
10,
11, 12, 13, 14, 15. One more time.
1,
2, 3, 4, 5, 6. Great job.
8, 9, 10, 11, 12, 13, 14, 15.
All right, if you all will trade places, and it's okay, you have 10 seconds to trade places. Okay. Let's go. 2 thumb and circling hand technique. Okay, there we go.
1, 2, 3, 4.
Wrap those fingers around, wrap those fingers around. There we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Oh, just next time open that airway just a little bit more, just a little bit. There we go. 2, 3, 4, 5, 6. So I feel your seal is tight.
9, 10, 11, 12, 13, 14, 15.
There we go. Okay, great job, everybody. Woo, so now let's talk about how to help a victim who's choking. And so if you have an adult who is showing signs of distress, and you're gonna say, hey, are you choking? And I'm choking, universal choking sign. Please show me on your body your hand placement. We call it abdominal thrust. It was previously referred to as the Heimlich maneuver. Please show me how to do abdominal thrust on your own body. Okay, and so try to avoid the xiphoid process, which is the end of the breastbone. I tell students to imagine they know exactly where the pants, except for if the pants are down on the butt, but where the waistline is, you're gonna make that fist. The fulcrum is going to go above the person's belly button, and then you're gonna cup that free hand. So for you, it just seems like you're really close to your xiphoid process. If you just bring it down a little bit more. And do upward and inward thrust. And you do this until what happens?
The object is expelled.
Or
They lose consciousness.
they lose consciousness. And so for American Heart Association purposes, if they lose consciousness, we're going to assume they've died. You're gonna put them on the ground, you're gonna scream for help, of course, and you're gonna start your CPR. Knowing that every time if you did try to give a breath, it may not result in chest rise and fall because they have a blockage there. But you can start CPR. If you see the object, you can remove the object. If you do not see the object, don't go down there and start sweeping blindly because you can push it down further. What do you do if the victim's pregnant or larger than you?
Chest thrust, I think they call it.
Yes, and so same exact fist, knuckle, fulcrum, center of the chest, cup, and you go straight in. So it's not up and down like a sternal rub, it's straight in. And I had a student practice this on me at a high school, and he was taller than me, and it hurted. I'm sure I had a bruise. So I can imagine how effective that is. And I can also see why we don't let students practice this on one another, because it could actually cause an injury. How do you help a choking baby? So child would be similar, abdominal thrust. Infant, okay.
Yeah.
All right, so I be seated. This is the big baby. I'm not suffocating the baby. I'm just supporting the baby and aligning their head and their spine. My fingers are actually open, and I have like a little cup, like a little pocket of air between my face, between the baby's face and my hand. What do I do now? Okay, does the head need to be down? Okay, why?
Gravity.
Gravity. Okay, so here we go. This is what students are gonna do. Why is that a What are we trying to do?
Get that object in, yeah.
Dislodge. So here we go. 1, 2, 3, 4, 5. What do we do now? Oh, baby, sorry. What do we do now?
Well,
Not yet. Let's go. And they don't call this compressions, very good point, because the baby still is alive. We call this chest thrust. 5 chest thrusts. Let's go. 1, 2, 3, 4, 5. And we're gonna do this just one more time. 1, 2, 3, 4, 5. For classroom purposes, just one more time. 1, 2, 3, 4, 5. And then we're gonna look in the infant's mouth, because our babies are like heroic, and we're gonna put our pinky, not our large finger, and we're gonna do a sweep. If we can see the object, we're gonna bring the object out. I saw a video of a police officer helping a mom in the mall. I just saw it?
Yeah, I saw it yesterday, randomly.
Yes, and so he did that for like 2 minutes. That baby still was, had movement, the baby wasn't limp, and then as soon as the baby vomited whatever out, looked at the baby and passed it to mom. So it's not like, oh, just do it 2 or 3 times. You do it until either the baby becomes unresponsive or until the object comes out. If the baby becomes unresponsive, what do? CPR, flat surface. What questions do you have about this? Who needs to practice it? Be honest, because we don't take care of kids all the time. You good?
Yeah.
All right. Do you all need a break before you take your first test of the day?
Yes, please.
All right, so everybody, this was Eunice Mathis with Florida Training Academy. We're going to be signing off, and have a great day. All right, so thank you all for participating.